This presentation is intended to educate nurse educators on the best way to teach on neurological disorders such as CVA, which is stroke, and related medications. Important tips for nurse educators include provide clear directions, especially for online students. You want to encourage participation, ask questions, and gather thoughts. Give breaks. It is very tempting to finish class early by skipping breaks, but is not effective teaching strategy. You want to stress organization. You want to state clear expectations of your students and what is expected of them. As a nurse educator, you want to make learning fun. Discuss the importance of discussion and other classroom activities and the reason for the case studies. For neurological assessment, instruct your students on what are the important parts of a neurological assessment, such as headaches, loss of function, vision, visual acuity, seizures, numbness, pain, mood swings, and fatigue. Students should know why each of these is important during the assessment phase. Discussion questions can be a great learning tool used in the classroom and in the online setting. Ask your students, what is important in the assessment of a patient with neurological concerns? The learner should be able to identify important aspects of the neurological assessment. An assessment tool that's used for stroke is the mnemonic FAST, F-A-S-T, and it's an easy way to remember the sudden signs of stroke. F stands for face drooping. Ask the patient to smile. Is the person's smile uneven or symmetrical? A is for arm weakness. Is one arm weaker or numb? Ask the person to raise both of their arms. Does the arm drift forward? S stands for speech difficulty. Speech slurred or difficulty to understand. T is for time. You call 911 for any of the above symptoms. Even if the symptoms don't go away, call 911. So FAST is the easy mnemonic to teach nursing students the best way to remember the stroke symptoms. The importance of vital sign. Instruct that with stroke, the blood pressure is often elevated. Teach your students that absent pulses indicate atherosclerosis, thrombosis, or emboli. The goal of the neurologic exam is to confirm the presence of a stroke syndrome and establish the stroke severity to assess with a prognosis. A Glasgow Coma Scale. It's an important assessment tool in stroke patients. When teaching this to your nursing students, it will be a great learning activity. First, you want to explain to the students what the Glasgow Coma Scale is and that it's used in hemorrhagic stroke patients, and also describe the general consciousness in the patient with a traumatic brain injury. The Glasgow Coma Scale takes about 3 to 5 minutes, and there's no special equipment needed. You can give your students examples of scenarios of patients with neurological disorders. Students should understand how to score each. The lower score indicates the more severe the neurological deficit. You want to allow 5 minutes. Then each student should write their score on a piece of paper and hold it up. An overview of the CVA. You want to teach your students, what is a CVA? A CVA is an interruption of blood flow through an artery to one or more areas of the brain. It is a medical emergency. You want to instruct them on risk factors such as hypertension, coagulation disorders, lifestyle factors, smoking, excess alcohol consumption, drug abuse, obesity, stress, and lack of physical activity. Diagnostic tests that are important in the nursing implications. You want to teach your students the diagnostics test that is used in stroke, such as coagulation studies, carotid ultrasound, cerebral angiogram, echocardiogram, cranial scan, and this must be done 25 minutes upon arriving to the emergency department. Blood sugar level. Developmental considerations. Emotional and behavioral changes. Tell your students what to look for. Aphasia. Develop ways patient can communicate to avoid frustration. Memory. Preparation of therapy such as physical therapy, occupational therapy, and speech therapy. Dietary concerns and safety. But the most important part is medications. The goal of this learner will be to identify common medications associated with the neurological system. You want to lecture on different classifications of neurological medications such as analgesics. Example of that is codeine and morphine. Anticonvulsants. Anti-Parkinsons such as levodopa. Sedatives and hypnotics. Muscle relaxants such as baclofen. Neuromuscular blocking agents. Antiplatelets used for CVA such as Agranox and Plavix. You want to teach your students what to look for, such as bleeding and bruising, and those are side effects of being on a blood thinner. You also want, when your students start giving medications, to be able to know that they're giving the right medication by assessing different techniques such as right patient, asking their name, date of birth, right drug, your right dose, right time, right route, and right documentation is important. Another good learning tool for a group activity is you could divide your class into groups 4 to 5 and have 4 or 5 members in each group. Have each group to choose 2 classifications of medications, a total of 4 meds, and discuss the important aspects of the medication and include the side effects in patient teaching. Being able to present it to the class so everyone can hear it as a whole. Majority of the information that we teach is presented through PowerPoint presentation, textbooks, readings, YouTube videos with evaluation through quizzes, tests, and case studies. Give students examples of application-style questions that will increase test-taking skills for the NCLEX exam. An example of an application question is, the nurse is providing client teaching to a female with multiple sclerosis. Important client teaching and educating on reducing fatigue and allowing the client to rest in order to preserve energy. Which of the following should the nurse teach the client to reduce fatigue? You can discuss this in your class. Avoid naps during the day is A. B. Ask your doctor to increase the dose of muscle relaxants. C. Rest in a cool area. D. Exercise 3 or 4 times daily. That correct answer is C. Rest in a cool area. You want to explain to your students why this answer is correct and help the students understand the rationale for why the answer is not correct. Again, we want to recap the important tips. As being nurse educators, we want to provide clear directions, especially for the online students. Encourage participation. This is very important. You want to ask questions and gather thoughts from your students. Give breaks if you're doing teaching in the classroom. Stress the importance of organization. And you also want to state clear expectations of your students and what is expected of them. Thank you.